Hello, everyone. This is Nousheen Mukhtar, and you're watching another episode of the Trailblazers podcast. And today we have an innovator in healthcare technology who's going to share many interesting insights with us. We decided to talk about healthcare today because innovation in this sector is much needed and can have a very long term impact on human life. Today, Mr. Padam Kafle is going to share with us details about deep tech and how deep tech is diving very deep into healthcare systems. He is the CEO leading vCodes software solutions, and innovation in this sector is something which is in his left hand. Let's talk to him today. Welcome to the show, Mr. Padam. How are you?
I'm good. Thank you so much for inviting me in this special episode. I think you rightly mentioned that the healthcare is something, is today everybody is busy. No
Yes.
one is caring themselves. So the healthcare is another, the aspect where the people has to be really careful of. So mostly if you talk about Dubai, right, because mostly the people there are either single or with the family also. Both the people are working together. So it is really hectic for them to take care of each others also. So definitely I think it's an important factor for us to discuss.
Great. Thank you so much for joining us. We are very happy to have you today. I'd like to know what is super intelligence and why it is important in the healthcare system.
So basically it's just to put simple, right? So there is a power in superpower.
Mhm.
So today, if you talk about the AI, everybody's talking about the AI, the artificial intelligence, and the super intelligence is much more, stronger, or it can have a lot of benefits, not just into the healthcare, any sector. But yes, I'm going to talk into the healthcare because I have been working in the healthcare since 21 years now,
Yes.
and deep into the technology from the day one and the single domain knowledge. So in the healthcare superintelligence, why superintelligence is because we are technically dealing with the sick care, not the
Mhm.
healthcare. This is the word of the CEO of Esther DM Healthcare, Esther Hospital, Dr. Servaj. So he always refer that we are not doing the healthcare in sick care,
Mhm.
because when you fall sick, you are going into the hospital or the clinics, and then you are getting treated. So what is true healthcare is you should know, or your the family or the parents or the anybody in your nearest, right? So they should know before you fall sick.
Hmm.
So that is what the true healthcare. So if we are really looking for true healthcare, then the super intelligence is something that is going to make that reality.
So, super intelligence is going to be predictive.
Exactly.
It will tell us before time that we are
Exactly.
about to have something,
Ab-
some trouble in health, and it
Absolutely.
needs to be addressed.
Absolutely.
Is your area of research around healthcare systems and how superintelligence can super optimize them?
Exactly. So my topic itself is the superintelligence healthcare.
Mhm.
So where I'm currently in the active research phase, and within the year I'll be submitting the thesis. So mostly the idea is how we can make the healthcare more predictive. More than people going to the hospital, why can't the healthcare provider take care remotely, or even visiting at home, without even people to go back into the hospital? For that, we need the prediction, right? So how the prediction can work is, obviously we need to know your health parameters, your history, your maybe genetic data, or there are so many things. There are a lot of sensors and all we are even working on, right? We are testing those sensors. So where the continuous your body parameters, the basic body parameters, we can actually analyze and we can predict if there are something abnormal going to happen. My research is more into that. So how obviously the human body is the most complex machinery in this universe, and every human body functions differently. It is not common at all anywhere, right? So that is where the personalized health and the super intelligence what can really be a game changer. So that's there on my research is.
Very interesting. You personalized health.
Right.
Why do you believe that it's very important for an individual to receive services in healthcare which are very personalized?
When you want to have food, you have your choice of the food, right?
Yes.
So the your choice may not be choice of everybody. Similarly, in our body also, the body choice is different, right? So your body, they work differently. My body work differently. So I may be sleeping by 9 o'clock, right? So now these routines are fixed. These are the habit, right? So we our body adopt this basic pattern. It's like the computer or the machines. When you are setting some pattern into your body, right? So your body start working in that way. So when you have such a pattern, right? So this pattern will work differently. So that is where you need personalization, because just even in the medicine, right? So I have been working into the healthcare. Even in the medicine, there are the medicine dose which in the specific group, specific gender, specific the area of the people, it act differently. So for example, if there is somebody's so much aversion of the antibiotics, right? So even for the small infection, you really need to go through the antibiotics, right? So there is again the different the medication you have to go through. So if somebody is really not into the medication, so there are a lot of home remedy people can work. So for example, in me, I never take the medicine if I am getting cough, cold, or fever, because I go with the home remedy because I believe in that. So my body always expect that I have to be go through those medicine, and then so the my immune system or everything, these all are personalized.
Yes, they're different.
Yeah. So when our body, the functionality is personalized, then definitely the healthcare has to be personalized also. It has to be tailor made for my body requirement.
As a researcher, what are some of the discoveries that you have made on your way and they have truly inspired you?
So obviously, as of now, the whatever I have done into the research, right? So there is much more we can do with the human health, right? So as of now, the healthcare is not that evolved, because it's, I would say, if you put into all other industry, healthcare is just into discovering phase, right? Because mostly, as I mentioned in the beginning, when you fall sick, you go to the doctor, doctor will examine, doctor will give the medicine, prescribe something, then again you have a follow-up and again see whether this is working or not, right? So this is the current healthcare system. But where we are envision that, so before you even something getting into your way, that we can predict and detect, right? And then we can work into that. So there are a lot of things again, right? The genetic health, like for the genome sequencing and all. So you can predict even after 30 years what is going to happen, right?
Yeah.
So in our body there are a lot of things which we can predict, but as of now the technology is not into that way that we can really predict. So that is where when I am doing the research, see, these all are the eye-opening things, right? What I am getting is there are a lot more things we can do as a technologist. When we talk about healthcare, I don't need to be a doctor. I don't need to be a nurse, right? I can be a technologist and I can really help people.
People have a lot of fears around that, especially when everybody says that AI is going to take over the regular nurses and it's the robots who are going to perhaps perform the surgeries. And it's the robots who are going to decide the dose of medicine for a patient. When patients listen to such things, they get anxiety and they feel that perhaps this could not be the right way forward. What are your views about this anxiety and this attitude towards the changes that are coming up in the system?
So AI is not replacing anything. This is just a myth, so the people feel that AI will replace. AI is going to upskill us. So just for example, in the computer, the things are happening in the computerized era or the beginning of the computerization. Everybody was thinking we are going to lose the job because now the computer is going to take over, right? But there, when we get into the computerized era, now we got to so many things, right? So there are a lot of jobs being created, right? Similarly in the AI also, there are a lot many jobs are underway, right? But yes, if you are not upskilled, definitely you are going to replaced. So
Yes.
I keep and give this quote, right? So I work into the software industry since 2006. So I have seen people who are very good into the Fox Pro and the VV and the in the DOS, but they didn't upskill. Today they are completely obsolete. So I don't want to be get replaced. So I'm to keep on learning into the new technology, new tech stack, new coding pattern. So It is completely in your choice whether you want to be replaced or you want to be upskill.
This is a good perception. So you think that everybody should consider that use of AI and robotics in healthcare is an upscaling. So we are upgrading the system so that better efficiency could be ensured, right?
Exactly. So if you see in the WHO data, there is a huge crunch of the healthcare worker, right? So this AI, robotics, those are going to be a assistive healthcare. So in our healthcare language, we call it a CDS, clinician distance support system, right?
Right.
So basically, they are not going to decide anything, but they are going to support you to decide. So for one doctor, if to prescribe the medicine or the entire consultation to finish in the traditional way, if it take maybe 10 minutes, now use the AI or the CDSs, it may be just complete in another 2 or 3 minutes. Right. So basically, we are saving almost 7 minutes. In the 7 minutes, maybe another two people we can consult and we can see. So basically, the AI or the technology are going to be assistive of the healthcare system, and they are not going to be replacement. That's absolutely, I can tell you very confidently.
Thank you. This is very encouraging. It definitely takes a lot of pressure off people and they try to understand it deeply. Yeah. So, coming towards innovation, you're not just a supporter of innovation, you have innovated. And we would like to know the new practices that you have brought forward.
So, the innovation is something that I really want to quote the chairman of the STDM Healthcare, founder chairman, Dr. Azad Mupan. He once he wrote one quote. I'm a big fan of him. So he was writing very, very clearly what is innovation. Innovation is something that everybody sees, but no one think differently. So if you want to be innovator, you have to look differently, or you have to vision differently, right?
Yes.
So for me, obviously, these are some courage, like from the top level when I was into that area, right? So even the CEO of the organization, he was always pushing that you have a playground, but you need to come with the different ideas, right? So and then of course there is one more concept that is something called the grassroots, right? So always the innovation or these decisions should not happen from top level, top to bottom. It should bottom to up. When we got all this environment, and I started interacting with the people who are really in the ground, and when we hear their problem, right, that problem is the opportunity for the innovation. So if you say that if we could save 5 minutes of the patient treatment time here, now when you think and come up with the solution, that is the opportunity for the innovation.
Yes.
Right. So if you really want to be an innovator, you have to think differently, that which everybody sees every day, but how differently you can do that, you have to think out, then you can be a innovator for sure.
We wanted to know a little bit more about Alif and other texts that you have been using and introducing into different systems.
So basically, when I started with the research, the algorithm, I was talking about the PASI, it's the personalized healthcare
Yes.
superintelligence. So I believe that the superintelligence can only happen with the personalization, right? So if our system knows much about our body, and then only we can, the system can give you the right, prediction, right guidance, and the right pathway. So
Right.
what you are supposed to do, how much time you have to go for the exercise, how much time you need to sleep, how much time you need to be in the fast. Even that is one of the parameter.
Yeah.
So if you want to be a healthier, you have to balance your body. But for that today, because people doesn't have time to think about, so even by end of the day, I may forget whether I have a food or not, because everybody is busy. So that is where the technology can assist people, saying that, hey, this is time to drink the water. Please go and drink the water because you have insufficient water. You have to keep hydrated. Whatever data we get from wearable, that can be a source of the truth, right? How your body is functioning, and then system can assist. It's
Right.
just the framework, but there are a lot more to work.
Right. So, are you creating wearable technology using FASI's algorithms and all that?
Yeah.
So that each person can know their
Exactly.
health statistics?
Exactly. So we are
Right.
completely in the research phase now. So the health band, I'm wearing this, and even the health ring, that is I'm wearing.
Okay.
We haven't made this available for people yet, but we are soon going to announce. So not only this, we are even working with the so many smart the wearables, like even the smart shoe, which can actually
Okay.
in the real time tell your BMI, because the most of the people are getting suffer with the the overweight, and they really don't know what should be their actual weight, because either they need to every day go and stand into a weighing machine, right?
Hmm.
But that is not possible also, right?
Hmm.
Our system can always track your data, and it
Yeah.
can give you the right advice.
Before the smartphones invented,
Mhm.
we used to have a handheld phone,
Mhm.
and we were not addicted to it. Like we listen to the call, make the conversation, put it aside, and forget about it. But
Mhm.
now this is in our hands all the time, and it has half of our life in it.
True.
So, do you think when we will get wearable tech for health,
Mhm.
we'll be completely into it? Because it'll be giving us updates about our health, about our
Mhm.
feelings,
Mhm.
about the way our body is responding to something all the time. So, don't you think that it'll engage us too deeply into thinking about ourselves and about our well being?
So everything there is a
Hmm.
pros and cons, right? So like
Yes.
having the smartphone, it has a benefit, because today 90% work you can do from your smartphone, right? You don't even need to open the laptop. If you want to write an email, if you want to pass the important messages, even today, that if you want to work in the Excel or Word or PowerPoint, you can do into the mobile, right?
Yes.
One is that. Second, you can keep on scroll the reels and you can pass your time, right? So it
True.
is more how we are going to use, or even the medicine. If you take into the required dose, it will help you to
Yeah.
heal your the illness. But if you are taking the overdose, it can become the addiction. The wearable is something that today, if you see, the most of the wearables now coming with the screenless. The reason
Hmm.
is to keep you away from the distraction, because most of the time, I was a big fan of the Apple Watch, but 90% time, even if I am sitting into the meeting, my habit was like this, because everybody used to think, oh, are you getting late for somewhere to go? So I decided to move out from the Apple Watch, because that is the one of the distraction I'm keeping away. So nowadays, if you see the wearables, the most of the wearables now is started coming without the screen. So it means it will keep on assess your data,
Hmm.
but at the end, maybe end of the day or the beginning of the day, you can make your routine. You can see how your health is going on, is improving, or there are some concerns. There are a lot of things you can be addicted of.
Of course. So self discipline is the key
Exactly.
to resolve such an issue. So let's move on to the next tech. Like you have told us about the personalized healthcare. The next one is Alif. So I wanted to know more about Alif.
Again, this is one of the frameworks, so we call
Hmm.
as advanced the life integrated framework. So
Okay.
it is more into the advanced life. How can your life be integrated throughout all these technologies?
So does that help us in optimizing habits and lifestyle choices?
Yeah, absolutely. Because see, most of the integrated source of the data, right, and then personalization is happening from the past. The integrated data should come from the advanced life integrated framework. It's like you have a sociology, like a healthyology. Like today, if you go into the Instagram or the TikTok or the Facebook, mostly we are just exposing our social life.
Hmm.
What if we are making that the healthy life to be promoted there, right?
Right.
We talk about health,
Hmm.
we learn about health from the others. There are many things that we can do. Being a human, right, we always follow the trend,
Yes.
right? So if somebody is doing the fasting, that everybody go into the fasting. If some of your in a star says, so I do the fasting 5 days in a week,
Hmm.
everybody go into that. Similarly, if we put into the health pattern and the healthyology into the those framework, that is going to be a game changer, in my opinion.
Yes, true. It'll make a community, it'll make a larger community of people who will follow health trends,
True.
and it'll all be synergized, and it'll not look like you're doing something intentionally, because you're automatically recording everything and
Exactly.
getting the feedback, and you're getting incentivized for continuing those healthy habits.
True. Yeah.
Okay, this is interesting. Very interesting. How did the idea came up?
So it's more into, again, it's from the research. The when you deep dive into the research, there are a lot of opportunity you can see, right? So the research is not just to doing your doctorate, but also to see how can we contribute into the society.
Yeah.
Being a human, it is our first responsibility to give the benefit to the society, not for the monetization. Money is byproduct. If you are keep on running behind of the money, you'll not be able to do anything. So the more is our intention should be very, very good. Our intention should be correct. So when you do the research, if you are putting the research in the way that you are just going to get the degree, then you will be just focusing in that. But if you are putting the focus, you need to help the people, or your research can be helpful to the others. Then all these ideas can emerge there.
How is vCodes contributing towards building a fresh future for healthcare?
So in vCodes, we are a deep technology, so we are more into the research focus. So basically, not just into the healthcare, we are into five different framework we are working in now.
Okay.
So although it is a startup, but then we have a different vision, right? So obviously, the wearable is one where we are working on. We are also working into the video intelligence, where so the entire your shopping experience into the shopping center, or the entire surveillance experience, that will be much different than what we have today. And we are also working into the something like the geo location tracking. So this again the small piece, but then this also we are putting into entire algorithm where your entire asset can be tracked automatically. You don't need to get into any of the this thing. And the other one I'm talking about, the healthiology. The healthiology is more into the the mobile app concept, where you can integrate the data from all the data source, and more than the socialize, you can you can get into the healthy discussion with the people. So these are the vision roadmap as of now we have. And of course the fifth product we are working into the cybersecurity, because cybersecurity is something, it is the big concern for everybody today. How we can make the people aware, or even you don't know if you in your home, in your home Wi-Fi, if there's something the some ransomware is already there, right?
Yeah.
So our aim is to go from the end users, the end to end, how can we make them secure also, right? So it is completely in the digital era, from the health to the intelligence, the visual intelligence, to the cyber intelligence.
Cyber intelligence is the most critical area these days,
Of course, yeah.
as there is massive data that needs security and management. What do you believe super intelligence can do to ensure security for cyber intelligence data?
So mostly, see again, the super intelligence would be in the framework, right? But the if we want to secure our digital asset, so there are definitely the blockchain is something that we have to adopt today, right? And the Wave 3 mostly into the healthcare data. The Wave 3 is another way where we can let people to decide what they want to share and with whom and up to what time, right? So the blockchain and the Wave 3 is the way where you can secure your data, you can control your data, because in today's world, in the essence of the Wave 3, your data is, when you give the data to somebody, this data is already out of your hand. But when we are putting Wave 3 to the healthcare data, that is where you will be getting the capability to control your data. So these are not just for the cybersecurity, but for the your general data protection also. If you see, the blockchain and the Wave 3 is the only way, because as we said that super intelligence, we are moving toward the supercomputing era. When the supercomputer comes, the today's encryption are nothing. It's like a very weak chain. When we are going with the supercomputing power, we'll have to have that level of the data encryption or data protection. So where I personally believe the blockchain and the Wave 3 are the way of protecting our data.
As a leader, what motivates you the most towards leading efficiently?
So the leadership is not just the title; it is a big responsibility, right? Being a leader. So what I have seen from my leaders in the earlier job, right? So there are leaders who really want to give you the credit. They do the effort and they give the credit. So in actually in our language we call it in the leadership language we call it a transformative leaders, right? But then there are some leaders who really want to control you and who want you to work, but at the end the credit will be taken by themselves, right? So now, if you want to be a role model, you have to be a transformative leader, right? So you have to have people, let work in their way. You have to be a kind of a mentor. My previous organization, I used to always mention my CEO as a mentor because within my the tenure, I never seen the single time he have been shouting on me. But if there are anything, not only me, the everybody, whosoever reports to him. So the way of his leadership is it was really unique, and I think that is inspired me today. So how the people has to be treated, right? So the way you want to be treated, you have to treat the people in the same way, right? So today, what I learned from him, I'm actually applying into my leadership because I was with the good leader. I'm trying to be a good leader, right? So definitely, the freedom is something that you have to give the freedom to the people and let the people feel that they are not being micromanaged. They have authority to work and getting the work done. Now, of course, the integrity is one part. No leader should forget the integrity because there are, my grandmom always used to say that everything is possible to get back. But once you lose the integrity, that you will never get back, right? So whatever you be a CEO, you be a president, you be a anybody. Once you lose the integrity, the people are not going to trust you. So being a leader, you have to have that integrity in place. Again, I want to quote the because obviously I admire a lot of the Dr. Azad Mopan. So once he wrote, to the entire employee saying that what is integrity? The integrity is something that you are working all the time when someone is not looking, not looking into you or not monitoring you. Also, you are working the way that someone is monitoring you. It means by intentionally you are not doing any mistake. So being a human, the mistakes can happen, right? But if we are doing the way that we are being watched by somebody in 24 hours, our integrity will always be in the place. So being a leader, it is always very first. I think the very first the KPI of the leadership is you have to have your integrity in place. Very true. And good intentions matter big time. They bring us very good rewards. This being said, how do you balance your ambition with integrity and authenticity? Like, of course, you want to grow in your career and you have, alhamdulillah, secured very good positions. So, how do you balance your ambition with authenticity and integrity? So it should be through your the work with through your effort. So there are a lot of shortcuts always, right? So you can take a shortcut, but those shortcuts are for temporary. So the brother of my mother, he always used to give the example, So if you see the dog, when the dog given the birth, the puppy can walk in the few minutes, right? But what is lifespan of them? Hardly a 10 years, right? But when you see the elephant baby itself born in the, I think, almost 2 year, right? And then to grow up into that area, right? It will take time. So their lifespan is above 100 years, right? So now this in the leadership also, it is the same thing. You can be a quick leader. You can earn the money very quickly. You can get the revenue very quickly. But in that, you are going to compromise so many things. And whatever thing you do very quickly, that will destroy also very quickly. Right. So if you want to build something for the long lasting, you have to really put your efforts. It will take time, but then it will be there for your legacy. It will be there for your future. It will be there for your children's or for the your coworker. Even if you go, right? So there, this thing will keep on there for the people to help. Yes, true. You have mentioned many times that everybody is very busy and there are only so many things to take care of. So I totally understand that coming from a tech background where you have to outperform, where you have to secure more and more goals. How do you balance as a CEO? How do you balance your personal and professional life? How do you wade through so many tasks that need to be done and you do them and yet you have personal time? I think there is something called the smart work we are talking about now, right? So you have to manage your tasks. You have to have your own discipline. Like for example, my philosophy of working is, I make my rule and I don't break those rules. So if I have a bedtime, I don't go into that bedtime. if I have a getting up time, that time I get off. So all every day's routine, it is being scheduled and I finish in that. And mostly 99% that the work, what is my office work, I don't take it home. I do into office. When I'm in the home, I'm with my family. When I'm in office, I'm completely with my work. So
Right.
I think making your own rule, how you are going to work, that is really matter. So that either it is in your personal life or the professional life. So when you make your goal that this is what my today's goal, and then you can actually work toward that, right? So the balancing, the obviously the work life balance is the big topic today, right? The people are a lot of people there are in the anxiety, in the depression, because they are not able to, if they are giving a time to family, they are not able to give the time to work and vice versa, right? But if we are making a clear goal for ourselves, then that can definitely be mitigated.
Discipline is the key again. What are some of the very interesting experiences that have given you a strong sense of purpose in life?
There are many, right?
Share one or two.
One thing, what I believe is giving back to the society.
Mhm.
So many people, they think if you are giving back something from you, then you will be poor, but that is absolutely wrong. More you give back to the society, more you will have abundance. I remember in my very, very childhood time, my sister, she used to say, "You are not even earning something, and you are very, open to give back to the people." At that time, in our language, I was telling her, I always prefer the Almighty give me the capability to giving back, so I should not go and ask back. So I think the attitude, our attitude should be, obviously everybody's life has a purpose to being in this earth, right? And I think no one is different. Everybody has their own capabilities. Somebody may earn big money or somebody may earn the little money, but for the needies, if we can help, that is the one purpose of our life,
Yeah.
right? So it doesn't matter how much you earn and how much you save, but how much you are making impact into the other's life. I think that is something that people are always going to remember. Even you can be a billionaire, at the end, if you are dying as a billionaire, people will just say, okay, this billionaire died. But even if you are dying as a poor, but you are actually investing your entire money or the income to the people life, this people will always make you as a role model. This is the one strong belief I have. Giving back to society, it is not just the compulsion, but it's the people's choice. But our choice can make us who we want to be. So more you open your hands, the more you will have
Yes.
opportunity to get back.
Like
Also.
the more we will give, more abundance we will
Exactly,
attract into our
exactly.
life. Looking back, what is the defining moment that made you say, yes, tech is an area where I want to work and where I want to excel and where I want to make my mark?
So we used to go to the cyber cafe. So that time the yahoo.com, we used to log into the Yahoo email, and we used to write the email. Of course, the 15 rupees per hour we used to pay for. I really want to make like this, right? I want to make this something that where I can put my username, password, and login. So that was one inspiration, I think, right? So from there, then it attracted me that how can I be a software engineer? Then how can I write a code?
Right.
So obviously, grace of God, today I think as I speak, the thousand of application I wrote in my life. So those definitely might be helpful for many people also. Mostly because it's in the healthcare, so the many doctor, the patient, or the care providers, right? So they could get the benefit of that. So that was the one moment I think I remember in the childhood, because always when we went to a cyber cafe, so I used to think, why can't we make? So one philosophy what I have is, the God has given the equal capability to everybody. We have to aim high, and obviously I'm a big fan of the in the Bill Gates. I read the history of the Bill Gates, right? So you have to something you have to aim, you have to go behind that, you will get it done. Okay, so for the good thing, I think you should have some aim and you have to go behind that. So there is nothing impossible in your life.
Very true. So if we aspire to be someone, if we pursue the aspiration with passion, and we are able to work towards it with, let's say, strategy, focus, consistency, we will definitely reach at
Right.
a very higher pedestal.
Right.
And I can see that in your example. You said that it's important for us to focus on what impact we are making. So, personally, what does impact mean to you?
So impact is something that with your action or with your the support, how many people can flourish? When we are speaking, many people might be dying with hunger. Can we feed some people with our effort? There are so many people, those are struggling for the getting basic education because they don't have a money to afford.
Yeah.
Can we be the one to support for some maybe of 5 childrens if they can get the education of their life? That is the impact what we are making, right? If somebody is really ill and if they don't have a money to get it treated, with our small support, if they are getting treated, that is the impact. So the people who are in need, if we can be a helping hand of them, that is some impact that as a human we have to, and that is the purpose of our life.
Very true. Making the lives of others easier and better. That is true impact. I
Exactly.
agree with you 100%. As we move forward into the future, let's say towards a vision that so many people are talking about of a future flourishing over technology where people have more time for families and more time for themselves, and they're very health conscious and they know their agendas well ahead of time and they can control the way their bodies are performing and their minds are performing. Don't you think that it's more of a utopian feel and it still appears like a dream?
If you have a dream, then you can achieve. I'm again a big fan of the sci-fi movies, right? If you see the future, what they are going to be, so this is already predicted into those sci-fi movies, right? So this is definitely going to happen, but how quickly and how much we can contribute into that is the difference. Care with the technology, care with the data, that is the future for sure. But then if we are work toward that, right, that dream comes true.
So, when we will have, I'm trying to understand our future. So, when we will have a greater future where we have a lot of time at hand and we are not very occupied and we are able to achieve a balance between personal and professional life also, and there are moments when we are done and there is nothing much to take care of. Do you think that it will be a happier space for people, or do you think they will have more anxiety about what's coming next?
In my opinion, obviously not, because more you are being luxurious, more your life will be shorter. Because the human body is needs the activities.
Yes.
If you are
We need
very active,
hardships.
yes, if you are very active, then you can live longer, because every function of your body should be function all the time the way it is supposed to be. Let's say you are just sitting into one place for the 10 hours, then you are actually reducing your lifespan, because that is not good for your body, right? You have to have activities. Yes, so the luxuries come with the price, not just the money, but price with your health also. So one way, if you see that, you will get a lot of time when you have this supporting system, so you can do more physical activities. You can walk, you can do the exercise, not only for the physical exercise, even for your mental exercise. So I was watching one video a couple of days before. The video says, the vlogger says that the AI is making us dumb. So first I said, is it really? But then eventually, when I think, eventually it is right also, because if you see 10 year back, if I take 10 year, my first mobile number I can still remember, but I don't remember my wife mobile number today. The reason, because for our brain we are not giving that much of the work, because now the phone is there, we save the number, we can go, we can search, and we can get the number.
Yes.
So similarly, for so many things today, so we are using the ChatGPT or the any of the other tools, right? So mostly, if you want to do any calculation, you have a calculator. You don't need to put the stress in your brain. So the more you are not utilizing your brain, the more you will be, definitely you will be, moving toward the dump. This is absolutely true. So like for our body, we need a lot of exercise to do to keep it active. For our brain also, we'll have to have a lot of brain exercise. Brain exercise is what? the more thinking power,
Hmm.
more stress you give into your brain, then you can solve the more problem, right? So I think we have to balance, we have to understand our body, and the technology comes, we should take the technology as the supportive system and not just the replacement of the our tasks.
Hmm. But with every day, our life is more and more dependent on the way we use tech, isn't it? Like every action we want to perform is associated somehow with technology, be it electronics, home appliances, cars, phones, communication. Everything is becoming tech. So, how do you recommend to our listeners what habits should they adopt to use their brain more and more, set it to work, challenge it more instead of relying on, let's say, ChatGPT?
Obviously, if you want to do quicker, you can use all these tools.
Mhm.
But whenever you get a time, you should set your challenge for yourself, right? So, for example, if you are writing a one page of essay into the one page of the thesis, right? So instead of using those tools to write, you can get the key points from those tools. Definitely, those tools are there to support us, right? And then you can keep and write that. So when you are doing by yourself, right, so you can memorize a lot, you can get into the different thought. And of course the other thing, like for example the car, so I don't use my car if my destination is 2 or 3 kilometers. If I know this is only my fixed destination, I just go by walk.
Mm.
So the reason is because we need to keep our body also active, right? So similarly, we have to keep our brain active. So we can do all the countings when we are just ideal. In the morning, maybe when, so like usually I do the meditation in the morning.
Mm.
Like 1 hour I spend to meditate. And in that meditation, I just focus into the things and I try to memorize more and more and more and more, right? You can focus in your future, you can focus into maybe just a space, you can focus into some cities or some, nature or somewhere. But you need to do all these activities so that your brain can be more active. So the philosophy is more you use, it will be more active, less you use, it will be less active.
Okay. What is your vision as a CEO?
So the vision is, definitely one is how can we make more impact into the community.
Mhm.
Obviously, we are putting the banner of the Made in the Emirates, the product of Dubai, what we are going to, launch in Dubai, and that we want that to be, served for the entire world. It's not a very small vision. There are a lot of things into that, right? You have so many things to work,
Mm.
but my aim is definitely for me to live in Dubai. So it is a second home for me, right?
Of
So
course.
I have got so many things from this city, and I want to make this city name in the top, either into the technology or into the product. So our aim is very simple, that we made something that can help to the society,
Mhm.
not just to making money. As I said, the money is byproduct. We have to make the Dubai made in Dubai product for the entire world. So that is one of our vision.
Great, very impressive. Where do you see yourself in next 5 years?
Very good question. Obviously, if you ask me, obviously I want to be in the those where the millions of people are getting benefit from our product and service. That is my aim. If the 5 year goal, if I take, I want to set maybe 50 million people who are getting benefited from our service.
Amazing, very impressive, and I wish you all the best. Thank
Thank
you
you.
so much for joining us today. There is one message that you have to give to our listeners.
Important message is, believe in yourself.
Mm.
So there is nothing that you are being treated different by anybody, right? So you have to be the one how you want to be treated. Believe in yourself, have your integrity in place, don't aim for the shortcut, you know do your perfect work, and the your success is there, no one can stop you.
Amazing. Thank you so much for today. I truly enjoyed our conversation.
Thank you.